So basically, mindset, exercise, diet, sleep, meds. This is what you need to do. Diet is hugely important. What you put in your body, you are what you eat. Your mom was not wrong. Sleep may be one of the most fundamental things that we all forget about and don't think about, but massively affects how your body functions, how your cartilage can repair itself, how your connective tissue behaves. Exercise, if your muscle mass is decreased, then your bone mass is decreased. A whole host of problems happen there. Also, exercise induces sort of increased inflammation short term, but a type of inflammation that turns on a lot of good genes and creates new proteins that help in the repair capacity. Exercise also helps reduce rates of dementia, just so you know. But exercise is one of the most fundamental, best ways to treat any arthritic condition. Historically, we were told the opposite, right? Oh, avoid that. Don't do that. Don't exercise. Sit on your couch. Rest. Take a few days. Probably the worst thing you can do. Functional recovery is where it's at. And then mindset. Your attitude, whether you're an optimist or not, whether you have a positive attitude, your ability to inhibit pain signals and control the pain communication between the periphery and the central systems, hugely important. Or you can do what we normally do, which is take a bunch of pills and avoid activity. That is your traditional remedy. Remember I told you about the guy or the girl surgeon that says, oh, you're bone on bone, it's terrible arthritis. Here's a script for, I don't know, meloxicam, Celebrex, diclofenac, indomethacin, whatever. Here's your prescription. Come back when it hurts so bad. Just avoid that activity. How many of you have been told that or know somebody that's been told that? That's our traditional remedy. That's pretty easy to do. Write a script, say avoid activity, come back when it hurts really bad. You can get somebody in and out of your office in 45 seconds with that. Trying to explain diet, sleep, exercise, mindset, and then supplements you can take to help give you more of those building blocks to fight the chronic inflammation, the oxidative stress, and the mitochondrial dysfunction, and the insulin resistance. That takes a lot of time and is harder. And certainly no insurance is reimbursing for that. But some of us feel a calling to share this information. So very strong evidence for diet to treat symptoms of arthritis, okay? I love the Mediterranean diet. That is my go-to. There are very strongly or big advocates for certain other types of diets, and they would rage on this, but I like the Mediterranean diet. I think it has the largest body of evidence to support it. It's approachable, it's affordable, it's been used for thousands of years effectively, and we know that the Mediterranean diet style or diet pattern reduces systemic inflammation by 30% in people with arthritis. Now, remember I told you it was a systemic whole joint disease? If you know that just what you're eating can give you a 30% reduction in that, why wouldn't you change your diet to the Mediterranean diet? I did, and my life has gotten a lot better. They've studied this. Here's just one study. Following this diet and adhering to it for about 16 weeks, people lost 7% of their body weight and had a 25% reduction in the progression of their arthritis. This is a micronutrient-rich diet. It gives you a lot of building blocks for cartilage repair, muscle building, bone health, brain health, and it is an anti-inflammatory diet. So it's going to reduce the production of all those proteins that induce inflammation. So I love the Mediterranean diet. This should be one of your primary weapons to avoid seeing people in white coats.